What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at 4 exercises for pain in the upper shoulder and neck region. We see lots of patients that have pain in this region. Maybe it's from working at their computer. It could be pain that radiates from the nerves in the neck. So if you've got pain in kind of this upper shoulder blade region, stay tuned for today's exercises. If you're new to my channel, my name is Dr. Tom Walters and I'm an orthopedic physical therapist. As I mentioned, pain in this upper shoulder and neck region is a very common complaint in the physical therapy clinic and is usually due to 2 different items. Sometimes people can have both of them. One is myofascial pain related to our upper trapezius muscle, this muscle on the top here that helps to shrug our shoulder. A lot of people have tension and pain in that region. We have another muscle that runs through our neck at an angle down to this top corner of our shoulder blade. This muscle is called Levator Scapulae, and if you run your hand right there, you can feel a lump, and a lot of times people think they have a big muscle knot there, when in reality it's just the normal anatomy of Levator Scapulae, but it can be a trigger point, kind of a tender point for people. So we have those myofascial structures, and then the nerve roots in our neck can also refer down into the shoulder blade region, the upper shoulder blade region, and even down between our shoulder blades. So in today's video, we're going to look at 4 exercises that address the myofascial structures, as well as the neck, the cervical spine, and the upper thoracic spine. So let's get into the first one. For the first exercise, we're going to use a massage ball. If you need one of these, I'll put a link down in the description. We're going to massage the upper trapezius and the levator muscle. So what you're going to do is take that ball and put it right here, kind of in that area, that tender point, right above the shoulder blade, and you're going to lie on your back. And you could just start here. Sometimes just having pressure just with body weight like this is enough to kind of hit the spot and work on releasing it. You want to have sort of like a hurts good, kind of moderate level of pain or discomfort when you're working on myofascial release. If this isn't quite enough pressure, there's a couple of different things you can do. One is to raise the arm. This makes the shoulder blade rotate. It moves through upward rotation, which puts a little bit of stretch on the levator muscle. So some people find this to be helpful. Another thing you can do is to do a bridge. So if I'm laying here, I can lift my butt up, and as I lift my butt, it shifts more of my weight over the ball. This is one of my favorite strategies. So you can kind of hold the ball if you need to in place. Once you get it locked there, it will kind of stay. You just kind of lift your butt up, kind of shift around on the ground. Find those tender points, and when you've got a good one, just kind of take a few deep breaths, hang out there, and see if you can get the pain to kind of dissipate in that region. So with myofascial release like this, you can do it several times a day. Usually you can do it every day. As much as it seems to help you, kind of lift up, hold like this. You can stay up and kind of move your arm. You can move across your body and just work moving that ball around and basically doing kind of a self-massage on, again, upper trapezius and levator scapulae. Our next exercise will be a 2-part stretch for upper trapezius and levator. So if you have pain, say just on one side, I'm gonna pretend like the issue is on my right side. I'm gonna put my right arm behind my back. That helps to tack my shoulder blade down and increase the effectiveness of the stretch. So for upper trapezius, this one, I'm going to pull my head straight into opposite side bend. So my ear is gonna go towards my shoulder. So if I'm stretching the right side, I'll move my head to the left, and I'm going to pull straight over and just gently pull with your hand. You should feel a good stretch here along the lateral side of your neck. So don't pull too hard on this. You just want it to be sort of a moderate level of stretch, and you're going to hold for around 15 to 30 seconds. Okay, so for upper trapezius, you're going straight to the side. For both of these stretches, I'd probably try to do them 2 to 4 times throughout the day, but again, you can do them as much as they help. You can do them every hour if they help. Now for levator, I'm going to rotate my head and look down at my opposite knee and then pull my head down at that angle. So this one will go a little more towards the back and kind of this oblique angle down my neck. So from my head down to my shoulder blade. So I'm kind of looking down at that knee and pulling that direction. Okay, so I've got upper trapezius straight to the side, and then levator, a rotation and kind of flexion component. Our third exercise will start to address the nerves that come out of the neck. So this is going to be for the median nerve, and this is called a nerve slider or nerve flossing mobilization. So again, if my symptoms are on my right side, I'm going to put my arm out straight at about a 90-degree angle so that my arm's parallel to the floor. I'm going to move my wrist into extension, and I'm going to have my elbow in full extension. Now that puts tension on my nerve running from my neck down to my hand. To put a little bit of slack on the nerve, I'm going to move my head towards that arm. So now my nerve is relaxed here but tight down there. So then I'm going to alternate. So I'm going to bend my wrist and elbow and move my head away. So now the nerve is relaxed in my arm but tightened at my neck. And so I'm just going to go back and forth like this. And again, this is called a nerve slider. It's helping my nerve slide towards my hand and then towards my neck. And we have studies showing that these types of mobilizations can help to improve the mobility of our nerves and improve the blood flow to the nerves, which can help reduce pain. So for this, go for around 10 to 15 repetitions. When you've done a set like that, you might kind of just shake it out, give it a little break. You could do another set right away, or you could wait till later in the day. You kind of have to experiment with this and see what works best for you. We want to be careful not to do too much with nerve mobilizations because sometimes they can cause the nerve to kind of flare up. So maybe just try 1 or 2 sets and then wait till the next day and see how your body responds. Our last exercise has the goal of improving strength and endurance of our neck muscles. In a lot of people where they have nerve referral from their neck or myofascial pain in this upper shoulder region, if we improve the strength and postural control in their neck, it often can really help. So for this one, all you need to do is lie on your back without a pillow, so just on the flat ground. What we're going to do here is perform what's called a deep neck flexor hold or isometric. So what I want you to do is tuck your chin in like you're giving yourself a double chin, and then lift your head just until it comes off the ground, and you're just going to hold this for as long as you can. Now if you experience pain or extreme fatigue, obviously you can just set back down, but your goal is really to hold here and to really focus on keeping the chin tuck. As people get tired, they'll want to let their chin come untucked, or they'll try to lift their head higher. So really just try to maintain this exact position. And you know, in the beginning, you'll probably be looking at 3 to 5 repetitions of this, and maybe you can only hold for 10 seconds, 15 seconds. But what you want to do is build up over time and try to get to around 30 to 40 seconds. In the research, we see that in people without neck pain, healthy people, on average, they can hold this for around 30 to 40 seconds. So again, if you get pain or fatigue, just set back down, give yourself a few seconds of rest, and then tuck your chin and go back to that position. And just every day, try to do 3 to 5 reps of this, and eventually over a few weeks, it will help to build neck strength. Thanks for checking out today's video. I hope the exercises help you. Just want to mention that my book is available on Amazon and Barnes & Noble. It has comprehensive rehab programs that allow you to do your own physical therapy at home. Each body region has its own chapter. So if we look at the neck chapter, we will see that there is this neck pain program. All the programs will describe common signs and symptoms, a description of the problem, basically allow you to kind of diagnose your own issue. And then you'll see that the programs are broken into 3 phases. They're going to include most of the exercises that I talk about in my YouTube videos, so they'll take you through 3 phases, and really are a more comprehensive program, sort of similar to if you came to see me in the physical therapy clinic. So really just more comprehensive programs that allow you to do your own physical therapy. If you would like to check out the book, I'll put an Amazon link down in the description. Thanks again for checking out today's video. I'll see you in the next one. Bye.